Good afternoon, everyone. For me, it's good afternoon. Carol, for you, it's good morning. So
All
I'll
right.
say good day. And we have the privilege to have you here on our channel today, Carol. Dr. Carol Kostovich has done much work in the area of nursing presence. She is a well-known scholar in the field of nursing science and also well-known in the areas that she is delivering um, service. So it's really a privilege for us, Carol, to have you here. We've cited a lot of your articles, and also we have used your PONS instrument in our research. So it's such a
Great.
privilege to meet you now. And I'm sure those who will view our conversation will be so excited to finally meet you. So thank you and welcome.
Well, thank you for the opportunity to speak on the Caring Presence YouTube channel. I'm so excited. I was so excited to find out there's a YouTube channel about Caring Presence. This is awesome. So thank you for the opportunity to share my passion for nursing presence.
Thank you. Carol, please tell us more about yourself and your career.
Sure. Well, I've been a nurse for a very long time. I have a bachelor's, master's, and doctoral degree, all in nursing. So one of my bosses that I used to work for years ago called me her nurse purist because all my degrees were in nursing. Um, my clinical area of expertise is adult health or medical surgical nursing. And I've taught nursing for over 25 years, both in the classroom, in the clinical setting, in simulation. And I've taught pre-licensure nurses in the clinical, acute care, and community experiences. For 19 years, I did that. Currently, I'm an associate professor in nursing at Loyola University, Chicago, and I'm also the assistant dean for innovative educational strategies and simulation. And so in that position, I oversee the simulation curriculum for our undergraduate and graduate programs. But as far as nursing presence, my interest in nursing presence started when I was in my master's program. And one of our required textbooks was nursing interventions. And I expected to see things in there like turning and repositioning patients. And what I found was a chapter entitled Presence. And I was really intrigued by that, thinking that presence could be considered a nursing intervention. And so I continued to study nursing presence then in my master's program and continued on in my doctoral program. And for my doctoral dissertation, I developed and tested an instrument to measure patients' perceptions of the nurse's presence, the nurse being present to them. And this is the instrument that you mentioned. And I'm so excited that you're using it. That's the whole point of it. That's the presence of nursing scale, the PONS. And then a few years after obtaining my PhD degree, I had a wonderful opportunity to participate as a postdoctoral nursing research fellow at one of our local hospitals, which was a U.S. Department of Veterans Affairs hospital. And there, during that fellowship, I developed and tested kind of a companion instrument. So it measured the nurse's perceived ability to be present to their patients. And so that's the PONS RN. And I am very excited. I was so excited that you said that you use this instrument. I've been contacted by graduate students and nurse researchers across the world who asked permission to use the instrument. And if anybody wants to use it, just let me know. I'm more than happy to share it. And I'm excited that you would be interested in it. So please just let me know.
Yes, thank you. So we will also put your details in the description to the video. So if there's someone who would like to contact you.
Wonderful, wonderful.
Yeah, that's a very exciting career. And such a balanced career in being involved in teaching and research and practice. And thank you for the contribution you've made in the body of knowledge in nursing. It's really meaningful.
Well, thank you. I've enjoyed every minute, and I say that in all honesty.
Right. Wonderful. We obviously love your view on presence and your definition on presence, or nursing presence. So could you please share with us your view on nursing presence?
Certainly. So in my work, I've defined nursing presence really an intersubjective human connectedness. So that connection between two humans, a nurse and a patient. And it's manifested through compassionate concern, openness on the part of the nurse and the patient, and a commitment from the nurse that's grounded in specific nursing knowledge and direct and indirect physical availability of the nurse to the patient, and certainly empathetic, focused attention. Mm-hmm. So in essence, I would say that nursing presence is being with the patient while doing for the patient. And this is really eloquently shared in Drs. Patterson and Zadirat's humanistic nursing theory. Mm-hmm. And I just think that's so powerful to be with a patient while doing for a patient. And what a privilege that nurses have that they can be in that situation with a patient. Mm-hmm. I think that care that nurses provide transcend time and space, and there's a fluid multidimensionality. So what I mean is that nurses can be simultaneously with their patient and provide care in the cognitive, the behavioral, the affective, and spiritual domains all at once. And nurses have that ability to fluidly move in and out and prioritize what that patient needs because they have that connection with that patient. I think that when nurses open themselves up to patients, patients see them as another human being, as another human individual. And that helps to facilitate the building of trust and confidence in the nurse. And then that's how you have a connection that's created. And when patients feel connected to a nurse, then they feel comfortable that they can talk to the nurse and share how they really feel and talk about what's really important to them and what's really going on in their life. And they can ask questions without being afraid of being embarrassed. And this is all so important for the development of patient-centered care. Mm. So we have to be able to connect in order to create that unique plan of care for that patient. Because if the plan of care isn't patient-centered, it's not going to be effective.
Mm. Mm. Wow. You just remind me of what a powerful gift nursing presence is. It's really encompassing nursing care. And it's so important. It's such a simple and complex concept at the same time, but it has such a huge effect on nursing care, on the nurse themselves and the patients.
Yes, yes. And some of the studies that I have done have reflected just that being present impacts not just the patient, but the nurse as well. Mm. So there's positive outcomes for both.
Definitely.
Yeah.
And that's also something that I would like to ask you about is what transformation have you seen in nursing practice where nursing presence is being implemented?
So to answer that question, I'd like to share two stories with you. Okay. So the first story is about a nurse not being present. So when I was a nursing supervisor, I was making rounds. It was an acute care unit of a hospital. And I was making rounds, checking on all the patients. And I walked into a patient's room, and the nurse caring for the patient was already there. And she was completing her morning assessment. And she checked the patient's IV bag. She checked the patient's IV site. She checked the patient's urinary catheter, the Foley catheter in the bag, checked the patient's abdominal dressing. The patient had had surgery. She asked how the patient felt. She asked them to rate his pain on a scale of 0 to 10. And she checked the IV pump. She checked the rate. And then she left the room. And when the nurse left the room, the patient said to me, and I will never forget this, he said, you know, I think she forgot that there was a real person connected to the tubes.
Oh, shame.
And that seemed so profound to me that even patients can recognize when nurses are not present. And this nurse was a great nurse. She was technically very skilled, very knowledgeable, but didn't make the connection with the patient as another human being.
Yeah.
So that's the not present story. But I would like to share a story that is so powerful to me. It's when I was a nursing instructor several years ago on an acute care med surg floor. And this is a story about one of my students. And I'm just going to call her Melissa. That's not her real name. But we were in pre-conference in the morning, and I had assigned all the students their patient to care for during the day. And I told Melissa that her patient was a homeless gentleman, and he had just been diagnosed with lung cancer. But the patient denied to the staff that he had cancer. He told the staff he had an infection. So about 15 minutes after the students left to go take care of their patients, Melissa came to find me. And Melissa said, Dr. Kostovich, can I have a different patient assignment? And I said, well, Melissa, why do you want a different patient assignment? And she said, well, my patient doesn't want to talk to me and he doesn't want me to take care of him. I said, okay, well, let's go talk to your patient together. So I went into the room with Melissa and I said, hi, Mr. Smith. My name is Carol and I'm a registered nurse and I'm the nursing instructor on the unit today. And today is your lucky day because you have 3 people that are going to take care of you today. So you have me, I'm a registered nurse, and you have Mary, who's the nurse in the hospital, who's been assigned to care for you. And you have Melissa, she's my student, and she's my best nursing student. So you have all of us to take care of you today. And I'm going to leave you now with Melissa, but if you need anything, just give me a call and I'll come back in. So I left Melissa with Mr. Smith. And I got busy with other students passing medications. And before I knew it, it was 11 o'clock in the morning. And it dawned on me that I hadn't seen Melissa. And at that point, I looked up and I see Melissa walking towards me down the hall. And Melissa had tears in her eyes.
Oh.
And Melissa said, and I could see Melissa and I thought, uh-oh, what happened? So Melissa came up to me and I asked her if she was okay. And she said, Dr. Kostovich, thank you for making me take care of Mr. Smith. After you left, we started talking and he told me he had cancer. And he said he never said those words out loud before and he never told anyone else but me.
Yeah.
And he said he will always remember me. And I get choked up to this day thinking about that conversation and how impactful even a student can be when you connect with the patient. And a lot of people don't think that students, because they're not experts, they're only students, that they can't connect with the patient, but
Mhm.
students have skills and they can be present and they have knowledge. It's beginning knowledge,
Mm.
but we we can be present even as students to patients. So I always remember that story, and that was so powerful to me, that just an encounter, and it wasn't even a long time, how that can impact a patient and really change the patient's life.
Wow.
Thank you for letting me share that
Yes,
story.
wow, thank you for sharing that. That's really a beautiful and powerful story. And to this day, it impacts other people, not only Melissa and Mr. Smith, but us as well. So we learn from that, and we really appreciate what she did there. And also, I think your role modeling of how to connect with him, how to have an entry point to who he is, and respecting him as a human being also meant a lot to her.
Mhm.
It,
Yes.
yeah, so it links to that definition you shared about presence, that it's beyond time and place, that it has a ripple effect also on other people, and how we can appreciate the humaneness of that.
Right, right. I agree. I
Yeah,
agree.
thank
Yes.
you for sharing that. So the big question is, how do we introduce nursing presence to nurses who are feel inspired to also try nursing presence, or who need to be made aware of nursing presence?
So I would say my recommendation is start when they're students in their pre-licensure programs. When I came to Loyola, I was teaching the first level medical surgical acute care course. And I started teaching students on the first day. A colleague and I started teaching on the first day what it meant to be present to patients. And these students, this was the first time they would be in clinical with their assignment, their patient assignment. So they had never been in clinical before. So we thought this was a great time to introduce them to this so that they would learn from the beginning how important it is to be
Mm,
present for their patients. So we talked to the students on the very first day of theory class about being present and its importance and being connected with your patient. And during the semester, we would ask the students again to think about, have you seen any opportunities in your clinical this semester where you could have been present to your patient? Or did you witness a nurse being present to a patient? So we asked them throughout the semester to reflect on their experiences in clinical related to the phenomenon of presence. And then we asked the students on the last day of the semester, we asked them to write about an experience they had in clinical where they believed that they were present, and really insightful reflections of how they connected. Students talked about singing with their patients and praying with their patients when they were receiving the last rites, and crying with their patients, a patient who didn't want to die in the hospital. So really powerful reflections on connecting as a student with their patients. Now, we've also included outcomes, learning outcomes for the first level medical surgical simulation course,
mm,
where the students come to the simulation lab and care for simulated patients. And in these scenarios, the patient provides cues to the students where, hey, this might be an opportunity where you could be present to your patient. And we wanted to see if the students could pick up on the cues, and they could. So it was really fascinating that even with a mannequin, a plastic mannequin, they were able to pick up on the cues. The faculty were the voice of the patient, and the faculty would guide them and provide cues for being present. And the students were able to do that. They were able to recognize, hey, this is an opportunity. I need to be present to this patient. And one of the students, in her reflection at the end of the semester, talked about being with a patient in clinical. And she said, you know, I was nervous because I felt like I had to say something, that I had to talk to the patient. But then I remembered back to simulation, and I remembered about the power of listening and just being with the patient. And then I felt special because then the patient shared all of this information with me.
Sure.
Again, another powerful story of a student who has made that connection with a patient. So we've started to teach our students about presence behaviors, but orientation in the hospital or into a clinical environment can also be an opportunity to teach presence behaviors. One of my colleagues, who was the director of the nursing orientation program at our affiliated medical center, they incorporated presence behaviors and into nursing orientation. So they focused on body language and what does that tell your patient, and how can you be present to your patient. Sit down next to your patient when you discuss the plan of care for the day. Don't stand at the foot of the bed with your clipboard, because that gives the impression that there's a hierarchy. You want to make that connection. So we talked about being emotionally present and the importance of verbal and nonverbal communication. So there's opportunities even after students graduate from nursing school to teach presence behaviors and emphasize the importance of presence behaviors in their care.
It sounds very doable. So if there's a team effort and an intention, then it can be done and it makes a huge difference.
And interestingly enough, this project for revising the nursing orientation program, it was part of an overall orientation program revision where these nursing presence behaviors were incorporated. And over a year's time, they measured patient satisfaction on these 2 units that were brand new units that were opened up, and all of these nurses went through this orientation program. And the patient satisfaction scores were very high on this unit in comparison to the other units in the hospital. So because of that, this orientation program with the nursing presence behaviors included in it was opened up to all of the units where nursing staff would be hired into. So that was a very positive outcome.
Excellent. No, thank you so much for that wonderful work that you are doing. It's really inspirational.
My pleasure. I'm very passionate about nursing presence.
Right, wonderful. Are there any projects that you are involved with that you would like to create awareness about, that you would like to share with us?
Sure. So our current project related to nursing presence, my colleagues and I are working to create a virtual screen-based simulation, an educational module to teach nurses or nursing students how to be present to patients. And we are going to initially use it in our first level medical surgical course, but ideally it could be used by hospital orientation programs for nurses who are in practice already as well. what we found is, especially since the pandemic, nursing students are extremely stressed. And even the literature suggests that nurses, practicing nurses, are some of the highest stress professionals, healthcare professionals in practice. And so we thought, what can we give our students? What tools can we give our students to help manage their stress? Something that they could take into practice and use in nursing school. And so I go back to some of my work at the Department of Veterans Affairs. And when I was there, one of my mentors was Dr. Jill Borman, whose area of research is focused on a stress reduction strategy called the Mantra Repetition Program. And this program is a mind, body, spiritual approach to stress management. So what's great about this strategy is that it's portable. It can be done anywhere. You don't need a special location or any special equipment. And it involves the repetition of a sacred word that the individual selects themselves. And in reality, it doesn't have to be a sacred word. It could be any word that's meaningful to an individual. And during stressful times, participants in this program are taught to repeat this word. And what it does is help the mind to slow down and focus and be in the moment. So it's really a pause button for the mind. Mm-hmm. And this helps create what's called one-pointed attention. And that's really what we need as nurses. We need to be able to just focus on one thing, and that's our patient when we are in there taking care of them, and making that connection and being present for the patient. So in my work at the VA, I conducted a study that was funded by the U.S. Department of Veterans Affairs, and it was a pilot study in which nurses participated in online learning modules to learn this mantra repetition program. And what we found is that after the nurses participated in this program, they experienced statistically significant increase in perceived compassion, satisfaction, and mindfulness and spiritual well-being. Mm-hmm. Now, from before participating in the program to after participating in the program, there was an increase in their perceived ability to be present to their patients, but the increase was not statistically significant, although, as we say, it was trending towards significance, mm-hmm. right? But our study only included 15 nurses, so it was underpowered, but we were still, we still felt hopeful and positive because it did make a difference in these nurses. So we wondered if using this tool, the mantra repetition program, as a tool, giving the students an opportunity to learn this in nursing school, to potentially decrease their stress in school, and then they could take this program with them when they graduate, and hopefully to address stress if they encounter in the workplace. Could we do this and start as nursing students when they're nursing students? So that's how we developed our plan to create this virtual screen-based simulation. And this simulation would teach presence behaviors. And we were coupling that with a program that's available online through PsychArmor. And it teaches it teaches mantra repetition. And it's not a long program because we didn't want something that would be very burdensome to students or nurses. We wanted them to learn the program. We didn't want it to be long and drawn out. So we're in the process now. We're working with a company to develop the virtual simulation. So hopefully within the next year or so, we'll be able to start our study.
Excellent. Oh, I'm so looking forward for your sake, and I believe it will make a huge difference. It really sounds like it. And
Hope so.
we are looking forward to reading about it and to hear more. Yeah.
Yes.
Thank you.
Yes.
Now, all of the best with that project. Sounds like it's really built on good foundations and also that it can have a good effect. Yeah.
Yes. Yes. Mm-hmm.
Thank you so, so much for sharing your thoughts and for the work that you do. And we wish you all the best.
Well, and again, thank you for this wonderful opportunity to share something that I've been passionate about for almost my entire nursing career.
Wonderful.
Thank you for this wonderful opportunity. I'm very grateful.
Thank you so much.
You're welcome.